Here at Hillcrest Wound Center, we treat a lot of different types of wounds. We treat diabetic foot wounds, wounds that have poor blood supply. We treat wounds that are caused by trauma or surgical wounds that aren't healing. Things like that is pretty much an everyday thing. Well, I couldn't ask for a better group of people to work with here at Hillcrest. Everybody is professional. Everybody helps everybody out. They help each other out. They help the patients out. We go above and beyond in most everything I've seen them do. They just excel. So we're here on the ground floor at Hillcrest. We have valet parking. We're easily accessible, and we have a great staff that will take the time to take those patients back out to the valet parking when they've had their visit. There is no true timeline for a chronic wound, but if you've got a wound that you've been treating for several weeks and it's just not getting better or it's getting worse, that's a chronic wound, and you need to come in and be seen at a wound center for treatment. If there's not good enough blood supply, the wound is not going to heal. So one of the first things we do, or first things I do when I see a patient here, is assess their pulses and check their blood flow. We typically always send lower extremity ulcers or wounds to get a vascular test to make sure we have good blood supply for healing. When a patient comes in, if they need other services besides what we can provide here, we may send them to OHI for vascular testing. We want them to have close follow-up with their primary care for their diabetes. We may have to send them to get x-rays or lab work, which is going to be done right here in the hospital, right above us, so they have easy access. So if someone has a wound that's just not healing and they're potentially on the road to an amputation, or they've been told that they need an amputation, then get a second opinion, come to a wound care and see if we can help you heal that wound. There's been many cases where we've healed wounds where the patient's been told they're going to lose their limb. Well, I would say to anybody who's at home trying to treat their wound and it's just not getting better or it's getting worse, please come in, let us evaluate it. We can treat that wound and make it better. We can get it healed.